Welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele, and we're going to take your calls, 415-561-8753, anything you need to ask the doctor, and later we'll be posting the doctor's phone number, so get ready to take that down. All right, Dr. Mele, let's talk facelift, shall we?
Yes, we shall.
Let's talk about full facelift versus mini facelift. A lot of women just immediately think, I need the full facelift, it's time, I'm this age, or I'm looking in the mirror and things are sagging. Do you really need the full facelift all the time? Is it?
It just depends on what we're trying to fix.
Okay.
I think mini facelifts work quite well for the side of the face, for the jowls.
The mini facelift?
In these areas, along the jawline.
Okay.
When we start wanting results here,
yes,
a full facelift does a much better job,
really?
Especially if there's banding, if the muscle, we can see the platysma muscle there and see those two stripes coming down. It's very difficult to make that go away in the first place, and it tends to come back pretty quickly if we don't correct that muscle underneath.
Speaking of that, we got some pictures for you to talk about, Doctor. Let's take a look at picture number one. What are we seeing?
So this is someone who had a full facelift, both elevated the face and a little bit on the lateral brow to sort of unload the upper eyelids.
Oh, so she did a little brow lift on that one?
Yeah, little lateral brow lift. And I believe we did a TCA peel under the eyes to help with tightening that skin up a little bit.
Looks really good.
She definitely got tan afterwards.
She did! She got tan after.
She was out and
She was
about
looking
a lot
so
more.
darn good. She went out on the beach. Okay, that's, so she just did the full thing. And so did her neck change?
So the neck, if you look at her central neck, not as much going on, so I didn't have to
you didn't have to really
do the platysma. But the lateral jowls, a little harder to see from this view, definitely come up, and we see less of that marionette line coming down from the corners of the mouth.
Exactly. Picture number two, let's take a look. What do we got?
So this is more of the side view, so we can see, again, the jowls along the jawline are tightened up.
Yeah, nice.
The area around the mouth, I think I did a dermabrasion instead of a chemical peel. It's another way to get rid of those little smoker's lines, even though she's not smoking. And then along the nasolabial fold, I took some of that skin that we would normally throw away and put it in along that fold in order to reduce the fold along the cheeks between the nose and the mouth.
That's really interesting. I never heard of that, putting actually some skin in there. That's really good,
but
with your own skin.
Than fillers. And the advantage is it's a nice, smooth, soft sheet. And it's firm. You can leave some fat on the back if you need extra volume, but the part that's out towards the surface is flat, so we don't get the lumps and bumps that we worry about with fat grafting.
And it's your own skin. So.
And it's your own skin.
All right, so, picture number three here.
Same idea here. So again, we've cleaned up the neck, got rid of that loose skin along the jawline. In this case, you may notice that her cheeks look a lot fuller.
I was going to ask that.
That's a very youthful look.
Yes, what is it?
I used a cheek implant.
You put a cheek implant
I cheated and put a little cheek implant in there. And that restores that volume that we lose as we get older.
Good. Now,
and also did the eyelids, just for full disclosure, so that's why your eyes look a little wider and open too.
I mean, that's an amazing transformation right there.
It's a nice change.
It is a nice change. I mean, wow. Okay, so cheek implants. We were talking, you put one in there, but when you do get a facelift or a mini facelift, fillers involved, fat transfer, what do you do to, do you do anything to put the volume back in?
Every option is on the table.
Really?
When I'm doing facelifts, since we are removing some skin, we've got that available. Rather than throwing it out, I'll often use it as a graft. Rather than using a filler like the Restylane, Perlane, and Juvederm.
Great idea.
Because those have a limited lifetime.
Yes.
And they don't need to be done in the operating room. So those are things you can put in the office very simply.
So if you do put the skin in in the nasolabial folds, I think I said that right. How long will that last?
Part of the blepharoplasty. It lasts several years.
It does?
It does eventually sort of atrophy and go away, but it's your own skin. It's all the dermal layer, the deep layer of the skin, with all the normal basement membrane things that make you maintain it. So it's a filler that comes along with all the normal things that your body recognizes to preserve and keep.
Love that.
And I think it works in two ways. It's more than just a filler, because fillers take up volume. We do that with the injectables. When I release this fold, I'm detaching that skin from the muscle. And you'll see even newborns some have this line, some don't. It has to do with how the skin's attached. If we just cut it, it tends to stick back down. So if we're cutting that attachment and we're putting the spacer in, it keeps it from sticking back down.
Genius.
So it works very well.
And recovery time, facelift, mini facelift?
Recovery time, a couple weeks.
That's it?
Yep.
And you can
Most
go back
of the recovery is waiting for the bruising to go away.
That's it?
There is some swelling, but that tends to resolve pretty quickly. And a little swelling on the face actually looks nice. I mean, it gives us back that volume and fullness. So.
It does. All right, well, thank you. Lovely. Let's talk to the doctor about his phone number. It's 925-943. What's your phone number, doctor?
I know, 925-943-6353.
All right, or check him out on the web, drmele.com or sanfranciscobreast.com. That was Facelift. We're coming back with blepharoplasty. And phone calls, remember 415-561-8753. We'll be right back on Body Beautiful.